Hi, everyone. I'm Sarah, registered nurse with Live Healthy Chicago and Rush University Medical Center. And today we're going to be talking a little bit about managing lung disease. I'm going to go ahead and turn off my camera and share my screen so that we can get started. So, the goal for today is going to be to learn more about lung disease and how to take care of yourself at home. We'll do this by defining lung disease, learning the facts, including symptoms and risk factors of lung disease, learn about how providers test for lung disease and some of the long term complications, and get more information about self management tips. Lung disease refers to several types of diseases or disorders that prevent the lungs from functioning properly. Lung disease can affect the ability to breathe or how well the lungs work. For the purposes of the presentation today, we'll primarily be focusing on asthma and COPD. Talk to your provider about what specific type of lung disease may be affecting you and their recommendations for you. Each condition is slightly different, but a lot of the recommendations for management are the same, and we'll go over that today. The lungs are important to move oxygen into your body and remove waste gases. There are filters and membranes that help. And with lung disease, parts of the lung may be damaged that make this process more difficult. Lung disease is very common in America. 1 in 13 Americans has asthma, one form of lung disease. In some neighborhoods in Chicago, that number can be even higher, up to 1 in 5. And this depends on people's family history, their habits, and the environment they live in. Lung disease is the third most common cause of death in the world. Today, we'll be talking about ways to keep you healthy and manage lung disease. There are many different types of lung disease depending on what part of the lungs may be affected. Airway disease affects the body's ability to move air in and out of the lungs and is primarily what we'll be talking about today. Asthma and chronic obstructive pulmonary disease, commonly referred to as COPD, are types of airway disease. Bronchitis and emphysema are different types of COPD. Lung disease may also be due to lung tissue damage from scarring or injury, such as pulmonary fibrosis. It may also be due to poor circulation of the blood to and from the lungs, such as pulmonary edema. COPD stands for chronic obstructive pulmonary disease and is a common type of lung disease. Emphysema or chronic bronchitis are types of COPD. With COPD, swelling constricts the airways and causes difficulty or discomfort in breathing, with less airflow in and out of your lungs. This can mean that it's harder to get oxygen into your body and it's harder for your body to get rid of waste gases. If the COPD is bad enough or worsens, it may mean that it's harder to exercise or stay active. Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This is usually due to triggers in the environment, which we'll talk about later. When you breathe in a trigger, more mucus is created, which makes it harder to breathe. This limits the amount of oxygen in your body, and it makes it harder for your lungs to get rid of waste gases, which can make it harder to stay active. Lung disease can be caused by many things, some of which you can't control, like your family history, allergies, or getting an infection. Other causes of lung disease can be controlled in order to help manage it, like smoking, your weight, and possibly breathing in pollution or other chemicals. Some of these causes may be a combination of things you can control and things you cannot. Talk to your provider about if any medications are appropriate for you to take to manage some of these causes. There are many symptoms of lung disease, but some of the main ones are shortness of breath, wheezing, frequent coughing, frequent respiratory infections, chest pain, and producing a lot of mucus. If you notice these symptoms, talk to your provider so they can do tests for lung disease. It is still important to take medicine for lung disease if your provider has prescribed it, regardless of if you have symptoms. One exception is if your chest pain is severe and comes on all of a sudden, call 911. There are a few tests that your provider can do to check to see if you have lung disease. The spirometry test involves you breathing into a tube attached to a machine. They will have you breathe normally and deeply in order to measure how well your lungs work. A pulse oximetry test involves you placing your finger into a small machine to measure the amount of oxygen in your blood, which should be above 90%. Sometimes this machine may not necessarily be accurate, depending on if you're cold or if you have certain disorders, such as sickle cell anemia. But it is the cheapest, fastest, and easiest test. A chest x ray involves using x rays to get pictures of your lungs to see if there are any blockages. And arterial blood gas tests can be done from blood draws to measure your body's oxygen and carbon dioxide levels. If left untreated, there are several risk factors for having heart disease in the long term. Some of them include colds and other respiratory infections, heart problems, difficulty walking or exercising, lung cancer, or high blood pressure in the lung arteries. We will go over tips to manage lung disease shortly, but it is important to manage it in order to prevent or delay long-term complications. One of the biggest risk factors for lung disease is smoking because it irritates the lungs and increases the risk of plaque in the heart and lungs. If you smoke or use tobacco products, quitting is the best thing you can do to reduce your risk of lung disease or prevent complications like lung cancer. Quitting is hard, but your body gets healthier each day it doesn't have tobacco and can reduce your risk of lung cancer, heart attack, or stroke. Talk to your family and friends about your goals to quit and talk to your provider about resources that can help you, which may include medication or nicotine patches. Smoking is just one of many irritants that may flare up lung disease. Another is pollution or breathing in chemicals. So try to avoid this if possible. Learning the triggers about what affects your breathing and avoiding them is important for managing your lung disease, especially if you have asthma. We'll go over common and less common triggers shortly. Everyone is different, so not everyone will have the same asthma triggers. Try to keep a journal to figure out what may be causing your asthma flare ups and report this to your provider. Some common asthma triggers include pet dander, dust mites, and mold. So make sure you keep your home clean and free of these irritants. Others may include pollen, smoking, or certain forms of exercise. Exercise is important overall, which we'll go over, though try to keep it at a level that you can handle and have your inhaler nearby if you use one. Other less common triggers include some things around the home, such as stuffed animals, cleaning products, perfumes, or possibly pests like mice or cockroaches. Again, keeping the home clean will minimize these triggers. Also, keep an eye out for food additives like MSG. Some people have reported symptoms due to their medications, so make sure you talk to your provider about your medicine and what you can expect. Physical activity can make you feel better, function better, and sleep better, as well as help you lose weight. It will also help make your lungs stronger. The American Heart Association recommends at least 20 to 30 minutes of moderate physical activity at least 5 days a week. Figure out a way to incorporate activities that you enjoy doing, such as dancing, playing with your grandkids, or walking. Bring along a friend or family member to make it even more enjoyable. 2 days a week, try to incorporate strengthening with weights or a resistance band. There are many ways to modify your diet to make things healthier and help manage your weight for your lung disease. Avoiding fast foods in favor of homemade meals is probably one of the biggest pieces of advice, but sometimes people think that's more expensive. Frozen meat, fruits, and vegetables, however, are just as healthy as fresh without breaking the bank. Try going to the grocery store for fresh or frozen fruits and vegetables, and avoid processed foods with extra sugar and salt. For sweet cravings, try berries and fruits instead of cookies and candies. White breads and pastas tend to spike your blood sugar, so try whole grain alternatives or brown rice instead. They also tend to have more flavor. Sodas and sugary drinks are less healthy, so instead try water with fruit or a sugar free drink like Crystal Light. Deep breathing has shown to be good exercise for the lungs. Belly breathing and pursed lipped breathing get the muscles stronger that help you breathe. For belly breathing, put your hands on your belly and take a deep breath until you feel your belly expand. Then breathe outward and use your abdominal muscles until you feel your belly contract inwards. For pursed lipped breathing, try slowly breathing in through your nose over 3 to 5 seconds, then out through pursed lips like you're blowing out birthday candles. Try 5 breaths in a row with closed eyes. So we're going to try the pursed lipped breathing as a group. I'm going to have everyone breathe in through your nose with me. 1, 2, 3, 4, 5. Now breathe out through pursed lips like you're blowing out a candle. A second time, breathe in. 1, 2, 3, 4, 5. And out through your mouth like you're blowing out birthday candles. Third time. 1, 2, 3, 4, 5. 4, 2, 3, 4, 5. Last time. In through your nose. 1, 2, 3, 4, 5. And out. Everyone is different. So, although many of these tips for managing lung disease can be applicable, make sure you talk to your provider to see what recommendations are right for you. Your provider will help you stay as healthy as possible in the setting of your lung disease. But make sure to schedule a regular checkup every year, as well as get a flu shot or other vaccines to keep you healthy and prevent respiratory infection. As always, make sure you take all medication as prescribed. With lung disease, sometimes there may be other options in addition to medication. So talk to your provider if you would be a good candidate for pulmonary rehab or supplemental oxygen. Thank you all so much for coming today. I hope you learned a lot. Have a wonderful rest of your day and stay well.